The epidemic we have in Ohio is fueled primarily by the pain med problem. We think about at least three-fourths of the people who are on heroin started with pain meds. The same thing would be true with fentanyl and carfentanil. So it's not just the people who are dying in Ohio of overdose of the pain meds. It's what ultimately that leads to. They get them addicted, and then they move on from there. So, you know, this is really cutting at the heart and soul of Ohio.
I want to spend just a few minutes, talking about some factors that I think make opiate addiction an extreme form of addiction, and I think that these factors largely account for the degree of carnage that we're seeing around this particular form of addiction. This particular graph, I think, speaks to the incredible danger that opiates pose to our society. If you look at the blue line here, the blue line depicts the rate of opiate dispensing and how that has changed over time. From 1997 through 2007, the numbers are actual. From 2007 through 2010, they're projected. The red line depicts the overdose deaths that our state has experienced. There is a 0.979 correlation between those two data sets. And in my 30 years of conducting statistical analysis in the behavioral health field, I have never seen a correlation of that magnitude. We are essentially measuring the same thing when we look at the increase in dosing and the increase in overdose deaths. It is the same phenomenon. So one of the things that I often hear, and I think I need to also thank the Department of Health for this particular graph, is that, so what? You know, we've always had addiction epidemics in our society, and we will always have addiction epidemics. And there is a measure of truth to that. Our society does struggle with addiction epidemics. There's no doubt about that. But I think that it's important for us all to understand the degree to which this particular epidemic represents or poses a threat to the health and well-being and literally the lives of our citizens here in our state. If you go back to 1979, in the early 80s, you can see the magnitude of deaths that were associated with that particular epidemic. If you move forward to the late 1980s and early 1990s, you can see the impact of the crack cocaine epidemic. Now move forward to the late 1990s and beyond, and look at the degree to which prescription opiates are causing deaths in our state. I would submit to you that there is no comparison, that this particular addiction epidemic presents a significantly higher threat than any other form of addiction that we've seen in recent past.
We don't know yet what killed Prince, but we do know that he had opioid painkillers with him. Millions take them, many are addicted. How did we lose control of opioids, and how do we get the epidemic back in the bottle? Jim Axelrod spoke to one of America's most prominent doctors.
This has been one of the great mistakes of modern medicine.
Dr. David Kessler, who ran the FDA from 1990 to 1997, doesn't hold back when talking about the explosion in opioid use in the last 2 decades.
Who's to blame?
FDA has responsibility, the pharmaceutical companies have responsibility, physicians have responsibility. We didn't see these drugs for what they truly are.
From 1999 to 2014, sales of opioids quadrupled in the U.S., and so did the number of opioid-related overdose deaths.
There was a notion that pain was the 5th vital sign, that you wanted to relieve pain, that was essential. You dosed until the pain was alleviated.
That, says Kessler, was a costly mistake. 78 people now die each day from overdosing on painkillers. But the CDC didn't issue prescription guidelines until this past March, recommending doctors try over-the-counter pain meds before prescribing more limited quantities of opioids, but not mandating they do so.
Given the fact that this country is in the middle of a crisis, are these guidelines strong enough?
We'll say, this is an American condition. This is an American disease.
And I heard about an increased number of deaths from opiates, now exceeding, with prescription opiates, deaths from heroin and cocaine combined. I heard from our Birth Defects Center about more babies being born at risk for congenital heart defects because their mothers had been taking prescription opiates. I learned about more falls among the elderly who were taking prescription opiates, about more drugged driving crashes. And just about the only mortality statistic getting worse is the increase in death from prescription opiate abuse. This is a major public health problem, and it's getting worse and getting worse rapidly.
And this is a sentinel health event. We are awash in opiates. We have not got right the balance between risks and benefits. By all means, for palliation of someone with cancer, we need to treat their pain. But for chronic pain, back pain, headache, you'd be hard-pressed to prove that the benefits of prescription opiates outweigh the risks of what are clearly dangerous drugs. A few doses result in addiction. A few doses too many result in respiratory suppression and death. Over the past 10 years, 145,000 Americans died from overdose from prescription opiates.
His fall was pretty bad.
I've had 4 knee surgeries.
I fell off the scaffold and injured my back.
First thing was a medication plan for pain.
It was just like, write the script, put the Band-Aid on it.
I have friends. I actually gave away my last medications.
We just kind of swap, or if one doctor denies you, you go to a different doctor.
I went to my grandmother's house. I was taking her pills. It was good when I was taking it.
It's just mentally and physically exhausting trying to pretend that something is not wrong when there is.
Okay, so there's something that I would like to show you. Every one of those little pills represent a person that we lost. And I want to tell you about my son. Got addicted at the age of 18.
Somebody prescribed him a medication. None of us knew the consequences.
I lost my son Louis at age 24. He started with pain medication.
I thought because a doctor prescribed them that the doctor knew what he was doing. He didn't even see the progression of it coming so quickly. It caught him off guard.
I get overwhelmed every time I see the wall because I was really close to being on this wall myself. If you look a certain way, you won't get addicted. If you're smart, you won't get addicted. If you have a good family, you surely won't get addicted. I thought it was the most selfish thing that anybody could do, and then it happened to me.
I never actually thought about my addiction too much. Now it's really making me see things more clear.
I feel guilty too because I gave some of my stuff away and my friend could have been easily on this wall.
All this could have been avoided. This wall has 22,000 pills, each carved with a face. Michael's story is just one of them.
This can happen to anyone. This can happen to you. Don't let it.
Well, we've got you all patched up. I'll give you a script for some ibuprofen, and that should help with the swelling.
Don't you think she might need something a little stronger?
You mean like This?
I don't think so. That's crazy.
Do you know that most prescription painkillers like Vicodin and Oxycontin are opiates, and they work just the same as heroin? And if not used sparingly, can lead to heroin addiction.
You know what? She's tough. We're just going to stick to the ibuprofen.
Sounds good.
The state of Ohio is the nation's leader in prescription opioid deaths. There's a statistical correlation between prescription opioid dispensing and prescription opioid deaths. Both have increased by nearly 800%. Legal prescription opioids kill more people than heroin and often trigger the disease of addiction. Ohio recently filed suit against Big Pharma for the deceptive promotion of opioids as safe for long-term use, which is in direct contradiction to scientific evidence from the CDC and FDA. This puts Ohio citizens' safety at risk. Ohio has an obligation to significantly and quickly reduce the overprescribing of this legal source of synthetic heroin. But what has Ohio done? For starters, Ohio can mandate that the CDC opioid guidelines be followed in the primary care medical setting. And Ohio can initiate this preventative step through legislation and with the Ohio State Medical Board. Protecting Ohio citizens' safety is imperative. For more information, visit danielslawohio.org.